right about the variability of when NAS actually materializes, when it gets diagnosed. And we think it's important to pay attention to which population of women we're talking about. Babies may experience neonatal abstinence syndrome when their mother has been treated for chronic pain or other medical conditions, who's been maintained on medications. There's a difference between that population, we think, in the kinds of interventions compared to a mom who's actively abusing or is dependent on heroin, for example, those that may be misusing their own prescribed medications, those that may be misusing non-prescribed medications, meaning they're purchasing or they're using their peers, or they're getting medications that are not being prescribed for them and misusing those pain relievers or with an opioid base. And then the difference between that and a woman who is in recovery from opioid addiction and is maintained on methadone or buprenorphine, who's receiving medication-assisted treatment, who is under the care of a physician and taking medications to manage her opioid addiction during pregnancy. And we have found in child welfare services over the decades that as trends in changes in particular drugs come into play, that sometimes there's a tendency to group all of families together as one kind of substance user and not really differentiate who are we talking about. Are there differences in the population? And we think what's key is differences in the interventions. Knowing that there are differences in pregnant moms and the kinds of substances that you may see a similar effect for the baby, but really need to understand what the differences are between the kinds of populations that you're being called about when you have a report. So let me turn to a little bit of information about medication-assisted treatment in particular and opioids during pregnancy. What happens when mom is not on MAT, medication-assisted treatment, and she's using a substance, either heroin or non-medical use of prescription drugs? What the baby is experiencing is similar to the mom's experience, with a high and a low of that exposure.